I'm Kelly Irwin, and I direct the Collaborative Care and Community Engagement Program. We're a clinical research and advocacy initiative that's dedicated to ensuring that mental illness is never a barrier to cancer care. We work to accomplish that goal by meeting people where they are. And sometimes that means literally going out into the community and meeting with them. But it can also mean using creative strategies to reach people, whether that be using phone or virtual video conferencing, or a combination of engagement strategies like using FaceTime to reach an activities director in a skilled nursing facility. Unfortunately, we've seen that people with serious mental illness, particularly bipolar disorder and schizophrenia, are experiencing higher rates of COVID-19 infection and worse outcomes. And therefore, we're trying to be as creative as we can to reach those people and to collaborate with their patients and families and community supports. Additionally, we lead a clinical trial that investigates the impact of using a person-centered, team-based approach, which means not just a psychiatrist, but also a social worker and navigator who partner with patients and families and their cancer care teams to reshape cancer and mental health care delivery and address any barriers to accessing care. And finally, we have a coalition, the Engage Initiative, which seeks to bring together all kinds of people who care about ensuring that mental illness is never a barrier to accessing the health care that we all deserve. During this time of the pandemic, I think the first thing that's really important is acknowledging that we've all experienced significant loss and taking the time to grieve that loss. And then, when we've acknowledged that it isn't what we wanted it to be, we can look within our new routine amid that disruption and find some moments of good. So for me, I usually wasn't home in the middle of the day, so it's been a new thing for me to be able to pick up my children at school and walk them home. And we've really enjoyed that experience together. Additionally, I think it's really important to find moments of connection at a time when many of us are isolated, and to be creative about how we do that. So to not just use Zoom, but go for virtual walks together, pick up the phone, write letters. I think also at this time as we head into the winter, I'd also want you to know that we're here for you as a healthcare system. It may look different. There are ways in which maybe it's been easier to reach people using technology, and other ways that it's been harder. But we want you to call, to reach out, and to do so early so that we can work together to support everyone's mental well-being. Thank you.